What's up, responsible people? So today we're going to geek out about insurance. I'm here with my colleague Michael, and we're going to be going over group health insurance benefits. So let me go ahead and introduce you to Michael. Michael, introduce yourself to the responsible people. Give them a little background as far as what you do.
Well, hello there.
And if you're a fantasy football champion, I just found out you're a fantasy football champion.
Hello, responsible people. My name is Michael Lattimore. I represent Dickerson General Agency currently. I have about 14 and a half years of experience in the insurance industry. Kind of started my way from the bottom at Choice Administrators, from customer service to renewals to inside sales. Now I'm working a combination of inside outside sales now for the large and small group market, and yeah, I'm here to service the responsible people.
So Michael, this is like the big question that I get asked a lot. As an individual employee, like a 1099 employee, or someone has their own business, they can't write off what they spend when they for their individual insurance, but they can write off the premium for the small group. Is that correct?
That is correct. Yeah. So the premiums for an individual, those are not tax deductible. But when you have it for a group, now those are going to be tax deductible. So all the premiums that they're actually subsidizing for their employees, those will be able to write off as well as themselves as well. There's also other additional benefits towards their bottom line, but I'll kind of sprinkle on those later on.
Got it. Now here's another question that I get a lot from like small business owners, right? Because being a small business owner is not expensive, but it's nerve-wracking, right? And people get a little nervous, when they want to get their first employee. At what level should a small business consider to get health insurance for their company?
So adding small business is really an investment in your business. We write groups, husband and wife, all the way from 2 people, all the way, up to, past 100. So it's really going to be, an investment in your business. Now, when you're investing that, you're going to be able to retain the top talent for your particular business. So that's going to help your productivity going forward. So it's really going to be, I would really suggest it as small as, 3 to 4 people. You'd really want to start to think about that, because it's going to help your bottom line, and it's going to help your future productivity and maintaining those employees.
Got it. Because I know in today's market, it's really competitive, right? I think during the pandemic, a lot of people kind of realized like, hey, I don't have to work at this job anymore and not get paid that much, and I don't even get benefits. Are you starting to see a lot more small businesses get benefits for the employees for that, reason, to try to be a little bit more competitive to attract the right employee?
Absolutely. I was actually going to get my mom and dad a pie at Polly's Pies, and there's a big old sign in there that says, opportunities available, 401k, and blah, blah, blah. It's like they have 401k at Polly's Pies. Wow, benefits. But benefits just shows you how important they are right now, just for, the common level employees as well. Benefits are definitely at the forefront, and then we've seen that a lot of employees will turn down employment if the benefits are not at their particular, something that they're looking for. That's definitely something that is really important now to today's employee.
Got it. Yeah, I have noticed that a lot of people will ask, oh, does it come with benefits? What's your benefit package? And it boils down to the health insurance, right? The 401k, I don't see that really much of like a concern, but it's more of the health benefits. Now, I have seen some employers offer benefits and they're not so good, and I see some other benefits that are obviously better. Now, as far as the rates when it comes to like health insurance, does the older employee get a higher rate? Does the younger employee get a better rate? If there's a mix of employees, is there an average age? How does that work? Just so the small business owner can know.
That's a great question, Nick. So with the insurance, with the small group medical market, it is age banded. So it's gonna be based upon where you live and your age. So every single year you're gonna be in a new age band. So yes, those older employees will be a little bit more expensive than your younger employees. So yeah, absolutely. So that's why it's important for the employer to have a good baseline contribution, kind of somewhere in the middle, so that it's not just helping out the young employees, but it's also subsidizing some of those older employees as well. Because remember, the more they contribute, the more they get to write off for their taxes as well.
Got it.
Yeah.
Now, I remember we you mentioned before, when a small business is paying for their premiums for all of their employees, you said that it works like a coupon because at the end of the year they get to write it off on their income taxes. Now, is it 100% that they get to write off, or is it 50%? What's the percentages?
It's going to be the premiums.
Okay.
So it's going to be the premiums that their contribution. So how much they're contributing towards their employees, that particular amount is what they're able to write off.
Okay, and it's the entire amount?
Yes, 100% of that amount. So if, let's just say they're contributing, 75% of like a gold plan, they get to write off all that amount, including their own contribution for themselves as well. Yeah, so it's a way that they're basically able to subsidize their own benefits. If they're going to go to the market, they're paying for that 100%, whereas they're able to put some of that on the business and get some of those monies back. So the business owner has that, that extra incentive for them as well.
Okay.
Yeah.
Hey, that's where I was kind of curious about, because as a 1099 employee, you have to have at least, let me go backwards, right? Because if you're only one person, you can't get a small group. Is that correct?
If you're one W-2 employee, yes, you can. Yeah,
but if you don't have a W-2 employee, you can't
cannot.
do it.
No,
Okay.
1099 would not constitute a group.
Got it.
And also an owner only would only constitute a group with certain carriers. So Anthem, Blue Cross, and Kaiser are the only carriers that will write a owner only group, and it has to be certain corporation levels. LLC, S Corp, they have to be of certain corporations.
Oh, okay. So that I didn't know. Now, so they at least need to have one W-2 employee, and it can't be themselves.
No, correct.
Okay, so
yeah, so it can't be a spouse.
Okay.
Someone like that, yeah.
So technically, it would have to be someone else.
Yeah, even let's just say it's a family company, it could be their child that works there. They can show that they're a W-2 employee. That would suffice. Okay. Yeah, we write family companies. Twins was kind of family company we wrote together.
Yeah.
Yeah.
Okay. Cool. Just gonna clarify, because I'm still learning all this information, even though I've been in health insurance for, I don't know, 14 years also, but I have no idea how the group side works.
It's a lot.
Yeah, so I'm learning, as we go, so it's really interesting. Other question, because now with the pandemic kind of like dying down, and do you see any concerns with, because I know the insurance company stated that if you get COVID, they're not going to be. You get COVID, and you don't have the vaccine, we're not going to pay for your medical bills. Do you see any of these, post-COVID type of issues that's going to happen with the health insurance, as far as the insurance carriers making giving the company maybe like a bonus for all their employees getting like the COVID shot? Because I know some previous employers, they would give you a bonus if you got the flu shot. So I don't know if you see any of that kind of trending.
It's definitely a possibility. It's hard to really anticipate that definitively. However, when things like this arise, like a pandemic, they've already made a lot of amendments into medical plans as far as adding in telehealth and things like that. So you will see things change with the insurance companies. They're going to be adding in different little benefit caveats and things like that. But as far as that particular one, it's hard to anticipate 100%, but I definitely wouldn't, count it out.
Got it. And that makes sense, because now telehealth, right? I mean, telehealth, but I think prior to the pandemic, there was still a bit of a cost, right?
There was.
Yeah, it wasn't a big cost, but it was a lot less expensive than to actually go to the doctor. But now telehealth is at a zero cost, right?
Yes, sir.
And is that how does telehealth work as far as, let's just say if someone is sick and they have the appointment, and as far as when does the doctor, if it's a serious issue, does the doctor still recommend you to go to the hospital, urgent care, or how does that, do you know?
If it's a serious issue, they are going to refer you to go into an emergency room or to an actual hospital. So think of telehealth as urgent care. Think of telehealth as Dr. Zoom. Okay. So, you really...
Dr. Zoom. It sounds like something from Marvel.
Dr. Zoom.
Dr. Zoom is here.
So think of it, it's urgent care Zoom. You want to, you know what? I don't feel good. I really don't want to go to the urgent care because, I possibly don't want to infect other people, as well as I just don't feel good enough myself, but I really need to get my medicine. You jump on that on your phone, your tablet, do your little Dr. Zoom, with your physician, and you can get your prescription right there, and it's at a zero copay. Okay. So it's a really game changer. It's really a way that you can kind of go around even your office visit copay. And it's not something like, oh, it's only for people that have COVID. No, you can just use it for whenever.
Okay. So I would also think like food poisoning, maybe the cold or flu. I mean, anything a little bit more serious, obviously, is gonna need to you have to go to.
Right. Mm-hmm. Yeah. So just think of it like, what, if I need to use urgent care, I can just use this and erase my urgent care copay.
Got it. Yeah, that makes sense. Yeah. Is there anything else that a small business should know when they're considering, getting group health benefits? Like, with any other advantages that they get that maybe that we didn't talk about?
That's a wonderful question. So they're going to get you and me. And so we are going to be the liaisons that's going to help them navigate these seas of group health insurance. So to alleviate that burden from them to having to, mind the benefits and things like that, we're going to take that burden off them. So that administration is humongous. The business owner can worry about just their business productivity. On top of that, there's programs like Section 125, which is a program it's a tax saving program that allows them to deduct the premiums on a pre-tax basis, which lowers their FICA taxes, their payroll taxes, as well as their workers' comp as well. So there's additional benefits, bottom line, for them as on the back end for them as a business. It's just all around the things that they get, as well as some carriers have different kinds of perks and free benefits, things like that they offer. So it's all around. It's a really good idea, especially getting with someone like yourself. You're going to help them with all these services. So it's really a well-rounded service for them.
Got it. It makes sense because at first, when it comes to group health, I was just thinking, wow, it's this daunting thing, and having someone that I can kind of, not rely on, but like trust as far as like, oh, this person's got more experience with the group health, because as many of the responsible people may think like, oh, Nick knows everything. Yeah, right. Like, health insurance is ridiculous.
It's hard for anyone to
Yeah, it is so ridiculous, and there's so many sides of it that it's so hard to know everything. Where I am a master at is on the consumer side and how they use their benefits, and it's making sure that the consumer is able to utilize their insurance to the max. Now, as far as all the benefits for tax deduction for a small business or even individual, or like what just Michael started, like section this and that went right over my head. So, but I'm glad I have Michael who knows that. And
we're a team.
Yeah.
So we're basically a benefits, a consulting team for these groups.
Got it.
You know what I mean? So, and this is also at no cost to them. You know what I mean? So we're helping them navigate them. My services at no cost to you or no cost to them. So why wouldn't you use these types of services to help you navigate these really complex things?
Yeah.
You know what I mean? Like, I'm licensed for these particular reasons to help people navigate these things because they are complicated.
Yeah.
You know what I mean? So.
And in what I like to always mention is that even though, an individual can rely on their company, their HR, to get them, to help them select their plan. They can go on to Cover California and purchase their own insurance. But as many people who have realized when they try to do it on their own, it gets really confusing really fast. So it always makes it easier to have a professional on your side, right? Like us. And we're not just trying to toot our own horn. It's just think about anything, right? Like, I have a mechanic. I know about cars, but I don't know specifically about an alternator or a starter or
Nope.
one piston going out. I know something's wrong with my car,
Right.
but I'm not gonna try to go on YouTube and try to figure out myself, right? I'm gonna go to a professional. It saves me time, and this is what we're here for, right? To save you time. And where we really come through, I think, where people really feel they feel the services is when something goes wrong, right? When something goes wrong, and you're in, it's like for example, like I had a customer who she had an emergency. She was out of the area. She was being denied at a certain location. So she calls me, and I'm like, well, I'm not the insurance company, but I have insurance experience, so I know what she's going through. Let me go ahead and help her out. And so I directed her in the path that she needed to do, and I gave her the reassurance, like, you know what, we're gonna take care of this, right? And I think that's where it makes such a big difference. Just knowing that you have someone on your side that's gonna back you up when things go wrong is probably worth everything.
It's huge.
So
It's absolutely huge.
always make sure that whenever you guys do anything complicated, it's a big decision, make sure you have a professional by your side, because when things go wrong, that's what we're here for. We're kind of like firemen in that sense, right? Like,
Not as heroic, but
yes, not as sexy either, I'm sorry.
Yeah, unfortunately.
There's no insurance broker calendar out there, but
There might be one, but I don't suggest you subscribe to it.
no, don't. It'll be one of those free ones that no one wants. So, good stuff, Michael. Thank you so much for, responding, answering my questions and acknowledging the responsible people, because, it gets a little nerve-wracking. I know a lot of small business owners, and they may get a little nervous about taking that leap. And I understand, adding health insurance for their employees it get costly. It can get costly.
And it can be daunting.
Yeah.
Yes, I understand.
But if it's broken down to you in a way where it's, okay, you know what? I think I can do this. And then at the end of the year, I'm able to deduct all of what I contribute. I mean, that's a really...
It pays dividends.
Yeah,
absolutely.
big thing.
Yep. And you'll have a professional like me that will show up at your business wearing Ren and Stimpy socks. So, yes, total professional.
Yes. Ren and Stimpy.
And some Christmas socks.
And Santa Claus. I know I'm past it, but it's technically still winter.
Gotta
Let's
have
go.
fun, Stu.